I actually saw an advertisement, and so I thought, well, I need to do something with my teeth. I've kind of neglected them for some time, and I'm 78 years old now. And so I came to Dr. Jane, and they did implants on the bottom, and those were, done very well. I'm very happy with them. And I was in today to have my teeth cleaned, and I was even happier because I was kind of dreading having in the past I haven't had people do cleaning without really hurting me, so that was excellent also. So this will be my dentist for life here, and I'll be back to see Dr. Jane about doing probably some implants on the top also. And so I would encourage people to at least come in for a consultation, because I think they would be amazed at what could be done with their smile, especially because you have some residual outcomes here, not just feeling better, but actually being able to eat things that you maybe haven't been able to eat before, and just it will change your life, I think. All the experiences were great. I mean, everybody that helped, all the way from the x-ray technician to the actual procedures, and then the people in the front office are very good, very courteous, and I don't think you could want for anything better. Yes, oh yes, very, very definitely. I can eat pretty much anything I want now, which is quite unusual because for years I sort of avoided some of my favorite foods, but now it's quite different. Not really. I had some personal experience with people that I knew who've gone to other offices and were not really satisfied with the help that they got there. Oh, definitely. I would recommend implant dentistry for actually any of your dental work, even if you don't need implants. If you just need what would be considered normal dental work and come in maybe 2 or 3 times a year, I think you'd be very satisfied.